Hi, Katie. How are you?
Happy
Can you?
third day.
Yeah, it's rough. Like I knew it was gonna be hard, but I was like, we just went through like 300 slides in 3 hours.
Yep.
Yeah. Oh my goodness. So, Katie, tell me a little bit about yourself, and your journey to becoming a physician assistant.
Okay, so I am Katie Rheberg. I'm a dermatology PA. I have been practicing since 2009. I have been in dermatology since 2015. I have two kids. I have a husband. I have a dog. Got a lot of stuff going on. But I love the profession that I have. I'm really, really fortunate to be able to do and practice in such a cool area of medicine. So, yeah.
Awesome.
Yeah.
Awesome. And in your, I guess, journey to becoming a PA, did you have any people in your life that mentored you or really influenced your decision to pursue this profession?
So yes and no. I've always known that I've wanted to be in medicine. Goodness, since I was 5, like a long time. And that was just something inside of me. Like it's something you can't really explain. And people just kind of reassured me that that was a good way to go, I suppose. My mom was a patient of Dr. Vasiluta's, who that's the practice that I work for. And Jen Beamgard saw myself and my mom and my dad. And my mom was like, you shouldn't go to medical school. You should go and become a PA. And I'm like, what the hell is a PA? I don't know. I'm not doing that. I'm going to be a doctor. I'm good. And then there you go.
So, did your mom already know about PAs? Like, is it because of Jen was a
Just
PA?
because of Jen.
Oh,
Just
wow.
because of Jen. She was like, she's young. She doesn't have to go to medical school and do the residency and do the whole thing. It's so
Right.
much like, why don't you do that?
Yeah. Awesome. So it all
I-
worked out.
yeah. I was
Um,
like 17 at the time. I was like, no, I don't know. What are you talking about? I have no idea.
did you consider, obviously you want to be in medicine, did you consider going to med school at one point?
Oh yeah. Yeah.
Okay.
I mean, up until my senior year, like my junior senior year, I was like prepping for the MCAT, doing all the things.
Research, and yeah.
And I was just like, it was the same prereqs, right? So like
Right.
all of my prereqs were the same. I wasn't really worried about that. Actually, for PA school, as you know, we have a couple extra things that medical schools don't need, like just
Microbiome.
anatomy and physiology, right?
Yeah,
Some
that's
psych
true.
classes. So those are some of the prereqs that PA has that med school doesn't. So thankfully, I made a decision when I did. So
Awesome. Yeah, I saw that you did your like undergrad and you got a degree in biomedical sciences.
uh
Do you
huh.
think pursuing like such a rigorous course load in undergrad, like pursuing that degree, helped you gain admission to PA school, or would you have chosen something differently if you were to go back?
I would not have chosen anything differently. I liked it,
Okay.
so it didn't make it like completely unbearable, I suppose. Um, no, I thought it was all going to be hard. I mean, no matter which way you put it, it was all going to be not an easy thing to do. I mean, so I started at Florida State and then I transferred to USF like mid junior year. So I took like a little sabbatical because I had gone through and now it's like really common for people to do this, I suppose. But I had gone through summer courses. I didn't take a break.
Wow.
So
Like
I
all through undergrad, you just went
all
straight.
through undergrad, I didn't take a break. Hold on one
Okay.
second. Sorry. So didn't take a break. And then finally, fall before my junior year, I was like, social chair of my sorority, super involved, really busy, and like getting to this point, and I was like, okay, I have to take a break. I went and I lived with my aunt and uncle in Kentucky. My uncle is a general practitioner, and I basically shadowed a bunch of people, and then came to USF and finished my degree at USF, and then went straight through again. So I did like spring, summer, fall, spring, graduated on time,
Oh, wow. Okay.
taking like 26 credits one semester and having to get like special approval to do it. It was nutty.
That sounds that sounds like a lot. I know, even
Yeah.
just working and doing school is a lot. So
No.
26 classes.
No. And I mean, y'all having to work and do the same thing, that it was asked for us to have clinical hours 100%. One of the reasons why I didn't get into University of Florida, um, but it wasn't necessarily hyper focused on, and it wasn't as competitive. I mean, and this is still only 2007. It's not like it was that long ago. That was only 10 years ago, right?
Yeah, somewhat.
No.
I'll give it to you.
I know. It's okay. I keep thinking that the early 2000s, it's just 10 years ago, but it wasn't. So I don't know. It would have been really, really hard to do both full time.
Right.
No idea how anybody does it.
So
So,
did you get any clinical experience before applying to PA
mhm,
school?
I
Okay.
did.
What did you do?
So, Florida State emergency room, nurse
Okay.
tech for 9, 10 months. So, like 2 semesters essentially. Um, Learned how to draw blood. Um,
Saw on the job?
learned, did chest compressions on, car accident victims, people coming into
Okay.
cardiac arrest. They're like, everybody line up and start doing them.
Nice.
So, I mean, I was 19
Okay.
when you're doing that. Crazy things
Traumatized.
too. It's traumatizing. I made, medicine's for me, right? You know my personality. I'm very like straightforward, and that's kind of what you need to be able to deal with some of those situations, especially depending on the specialty that you're in. But it also made me realize like I didn't want to do emergency medicine, so that was helpful. And then what else did I do at USF? I was volunteering at Moffitt in the tissue bank,
Okay.
so not like direct patient care. I think my only direct patient care was really in the ER. That was like the most direct patient care, but I still didn't get enough hours because I was only working like, 1 or 2 shifts a week and going to school full time. So like that wasn't gonna happen. Um, yeah, and then USF, Moffitt's tissue bank thing when they were like just getting that started. So that was in like 2006.
Gotcha. Awesome. That sounds like really good experience to prepare you. In
All over the place.
in hindsight, having gone through PA school, do you think it's important for pre-PA students to gain clinical experience before entering PA school?
Sometimes yes, sometimes no. I think it depends on the person. I think they're like pushing people out and like making people really work for it. I think it's also like having people change their careers because like some people will get into it and then they're like, oh, this is not what I want to do, but they've only been exposed to one part of medicine. And so maybe like derm might have not been the right fit or ER wouldn't have been the right fit, but then they didn't like keep going to know that they would have been really happy doing something else. So I don't know. Yes and no.
Okay. And of the like nearly 300 PA programs, I noticed like yours is very unique in that they hyper focus on training people that are interested in going into like a surgical subspecialty or surgery in general.
Yeah.
What made you pursue a master's in surgical physician assistant studies?
I wanted to be a surgeon.
Like, I just want to cut people.
I just want to cut. It was fun. I like working with my hands to an extent, probably also why I like to do aesthetics. Like I am a hands-on provider. I'm
Okay.
Yeah. It
Would you
was
say you're,
fun.
like a tactile learner?
Oh yeah, for sure. See one, do one, teach one all day. Yeah.
Awesome.
Yeah.
Um, and did you, like, what I know you started in, surgery when you first came out of school. What led
Uh-huh.
you to choose dermatology? Let's jump into that.
I always wanted to do derm.
From
Derm
the
is from the beginning. So like surgery for sure. And then I was like, no, derm for sure. And then, then you realize that you can do both.
right.
And when you get into it, I loved surgery. I love the OR. It's super fun. It's a little dark. You got to be a little dark, a little weird to be in that space. I mean, the same space is like emergency room. We're like very, very similar, but a little different. Um, so I just surgery is a lot. It's 60 to 80 hours a week as a PA. It's I mean, when I was there, it was 120,000 a year, which seems like a lot, but it's really not when you're working so much.
Right.
And when you're getting woken up in the middle of the night. And so you kind of go for both. You have to have a balance. And I think that's what a lot of people are looking for now, which is really good, is more of a balance because we need to make sure that we can take care of our patients too.
Right.
um, there's still those instances, and you're going to find it in the hospitals that they will work you.
Yeah. Um, and like for viewers that may not know, could you maybe speak on like the competitive nature of securing a job in dermatology, either right out of school or with experience?
Oh, it's crazy. It's crazy. Okay, so my first application with Dr. V was before I got out of school.
Okay.
So Heather and I, which is one of my colleagues, graduated around the same time. We're probably like 6 months apart, something like that. So both graduate in 2009. And I send my resume over, and he's like, okay, great. I had actually met with Dr. V before I graduated from PA school because I was like, look, I want to work for you. I want to do this, blah, 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 blah. He hired Heather before he hired me. And so he didn't have space for me.
Go figure.
So then I just keep applying to derm. Like I would go through spurts, right? I'm like, okay, I'm going to do neurosurgery. So I did neurosurgery for 9 months. And I was like, okay, I'm just going to, this is what I'm going to do. I'm going to focus on this. This is my first job. And you kind of forget about what you really want to do because you're focused on what you're doing on a daily basis, and you're trying to do your best. So I focused on that. And then I'm driving 30 minutes to this hospital, and it wasn't really great quality of life and happy with the physician and all of those things because all those things have to go together. And so then you decide, okay, I'm going to go to general surgery, but it's going to be at St. Joe's, so it's going to be closer to my house. Great. Well, then they can't afford to keep me. So that's like, I was there like 5, 6 months, couldn't afford to keep me. Then I switched to pediatric surgery at St. Joe's, and I'm there for 4 years, and I loved it, but it was a lot of work. I'm
Yeah.
still applying for derm. Okay. So like at these transitions, I'm like, okay, I'm going to apply. I'm going to reapply. Um, One of our reps, I don't know if you remember Jenna from Novartis. I ran into her like I was basically cold calling derms with my resume, going to their offices. She sees me and she's like, "Oh, don't go in there." I'm like, "Why?" She's like, "Don't go. You don't know. What are you applying? What are you applying for?" And like helps me. So it's
Uh,
trying to help me get a job.
okay.
Um, Fast forward, right place, right time. You get lucky, you get the opportunity, and somebody takes a chance on you, and then that's it. So
All she wrote.
it's a lot. I mean, it was it, I tried for a long time, and that's why I'm so glad to be in it. So
And you've been in derm for now how long since you started?
2015. So what's that?
So like 8
Eight
years.
years, going on
Wow,
my ninth year.
awesome. You see a mix of both cosmetic and medical patients.
Huh?
Do you feel the training that you received in school, since it's so heavily focused on medicine, that prepared you well to do aesthetics as well?
No, from a technical perspective, from a safety perspective, from an anatomy and physiology perspective, yes, absolutely. So basics, yes, but aesthetics is art. You can't teach that. You
Right,
can learn the techniques, you can understand, but that's why some people do it and some people don't. It's a creative kind of a thing, I think. So you either you can get it or you can learn it, you can work at it like anything else. But you should only do aesthetic medicine really if you enjoy it. Like people shouldn't be forced into doing that kind of stuff or yeah.
right.
You're good. I am in my pajamas.
You're all relaxed,
I
comfortable.
have been on calls all night. It's been crazy.
I know I have to go back and review so many lectures before class tomorrow, and then we have our first test, I think, next Thursday.
Sounds
So
about right.
yeah. Pivoting from dermatology, I know you mentioned you worked in as a PA in general surgery.
Yeah.
Has both like an inpatient and outpatient component.
Hmm.
What did your like day to day look like? Were there any like specific procedures that you were able to do, either independently or with your collaborating physician? How was that time in general surgery?
Sure. So, general surgery is a lot of laparoscopic procedures. It was working kind of side by side. So they would be doing one part of the procedure, whereas I would be doing a second part of the procedure. There was a little bit of colorectal procedures involved with that. There was the Da Vinci robot was coming into play as well. So you would be at the table next to the patient, and then I would have my surgeon at the robot. So there was things that I would do independently, running clinic, checking on post ops, writing orders, inpatient and outpatient, seeing consultations, doing workups. It kind of overlapped in the same thing with pediatric surgery too, and
And
doing procedures myself in like day hospital.
did you like what time did you typically get to work and when did you leave? I stayed there forever.
I was there all the time. So cases would start at 7, right? Surgery would start at 7. You would have to round before. So I would typically be there at 6. So I would be there at 6, and then it would just depend on what the day was bringing. And for pediatric surgery, if I was on call, I was there. If you got a call at 5 for a neonate or a kid coming in with a nappy, you would work them up, and then you would go do the post-op orders and do the case, and hopefully it wouldn't take too long, but I mean 6 to whenever.
Gotcha.
That's when my oldest son was little, and thankfully we had a daycare. They still have a daycare at the hospital. TGH has a daycare at the hospital, so does St. Joe's. And
Right,
so that daycare was, they were there 12 hours a day. It was
right.
nuts.
Oh my goodness. Yeah,
Yeah.
I can imagine like having young kids, either as a new grad or even now, just in school. I know some of my classmates, they have kids, and it's a lot. Like you have to balance all of that and learn medicine.
Yeah. Yeah.
it's, it's a
Hmm.
doozy. When you were seeking employment for your first job as a PA, what did that process look like? Right after you passed your boards. Was there like an onboarding process, credentialing? Could you speak a little
Yeah.
bit about
Yeah, so there's definitely a credentialing process that you have to go through with the hospital systems. But the interesting thing about interviewing with physicians and interviewing with solo practices, so it's going to be different. So when you interview with a solo practice and a solo provider, you're really just interviewing with the physician. You might meet with the office manager, but you're really just interviewing with the physician. But when you're coming into a bigger group, that's when you're interviewing with like the business side and HR and all these other people and stuff. But basically, the first line is always the physician. So you meet with them, and like, if they like you, they're like, okay, start working tomorrow. Like,
Wow.
they're like, okay, sounds great. Let's get started. This is what you're going to do. And most of the time, like, pretty physicians, as long as they like, if they know they want to hire you, they're going to tell you like right then. They're not going to like whatever. But the credentialing stuff can take some time. Like, those are the things that you have to do on the
Right.
backside, especially if you're working in a hospital. If you're not working in a hospital and you're not seeing your own patients, then it really doesn't matter.
Okay. Gotcha.
Yeah.
Now, as you know, most or every PA student has to take, very specific core rotations as part of
Hmm.
accreditation.
Yeah.
Do you feel your general surgery rotation prepared you well to work in,
Oh yeah.
pediatric surgery, neurosurgery?
Oh yeah. Yeah.
Okay.
Yeah. So I did UAB. We have general surgery, cardiothoracic surgery, and cardiothoracic, ortho, and general. And then I did
That's
an
like
extra
all
one.
mandatory?
Yeah.
Oh,
And then
wow.
I did an extra one in plastics. Um so it yeah, it was fine. Easy. But it depends on your attending. If your
Yeah.
attending doesn't let you do anything, then you're not going to learn. You have to, and you have to be confident in it. Like, you cannot be like, "Oh, no, I don't want to do that." Like, no, you're like uh, willing and able to do whatever they will let you do all the
Yeah.
time.
One of our faculty yesterday, they said, do whatever you can do on rotations because it's not your license. Like, if you do
Yes.
something wrong, like, this is your time to make those mistakes and learn from them.
Yeah.
But get in there, get your hands dirty.
Yes, 100%. And we're not going to jeopardize our licenses, right? We're
Right.
not going to let you take anything over the edge or do anything that you don't feel comfortable with. But part of it is a learning opportunity, and it's feeling the instruments in your hand, and it's understanding the different pressure on the skin, and it's doing all of these things that just like you don't think about it now. Like, I don't think about it now, but 15 years ago I did, and it was scary, but then you just do it. So I let
Now,
you do it.
in clinical practice, mistakes do occur. No matter how safe, confident, or meticulous we are, at
Yeah.
the end of the day, we're human and they happen. How do you ensure transparency with your patients about possible complications of a procedure?
So I try to just tell them at the beginning, like, bleeding, infection can definitely happen. Sutures can open up. Derm is a lot less intense than
Right.
the surgery stuff. Um, so, with but again, with my surgeons, my surgeons didn't necessarily always like sit with the patient and explain it. Like, they would do a broad thing, and then I would come in behind and like answer any questions. So just making sure that they know and understand the risks. There's always going to be a risk, but my husband's an attorney, and he will tell you that it doesn't matter how much you cover your butt, you can still get sued, and mistakes can still happen. And so you do your best.
Gotcha.
Yeah.
Awesome.
Yeah.
And when you're educating patients about their health, how do you like effectively take a complex diagnosis and put it in terms that,
Layman's terms.
yeah, layman's terms?
Um, when they look at me with a puzzled look on their face, and I'm like, let me just try it again. Let's explain this again.
Okay.
This part of your body, like, let's take psoriasis, right? Psoriasis is an autoimmune condition. It causes inflammation throughout your body. It can affect your joints. People don't like it when it affects their skin. It's an inflammatory condition. So part of the process is saying this is a overactive part. It's too hyped up. It's all the way up here. We need to bring it down here to a normal level.
Right.
Oh, okay. That makes sense. Inflammation is not good in the body.
Right.
Inflammation in your gut can cause an upset stomach. That's like something that they've understood. You have inflammation in a muscle, like it's sore, it hurts, you've worked it out too much. So just like bringing things back to like easy things that people recognize on a daily basis. They're like, oh, okay.
When you get that aha moment, you're like,
Yeah,
I met them.
yeah, exactly. I'm gonna have to plug in my phone.
Oh, sure.
I can still talk, but it's gonna go dark. I know you're recording.
Um, can you explain a little bit about the importance of sun protection? You work in derm, so obviously you see skin cancer all the time.
Bread and
Um,
butter.
how important is it for people to be protective of their skin? And then what are some things that they can look for in terms of monitoring for abnormal lesions?
Um, so sun protection is the one thing that you can do to help to prevent skin cancer. Okay. Three types of skin cancer: melanoma, basal cell, and squamous cell. Um, and there is definitely a direct correlation between, like, we know that melanoma has a genetic component, but it also has a sun component.
Right,
Basal cell has a genetic component. There's a genetic type of basal cell, but it mostly has a sun component. Same thing with squamous cell carcinoma. So, there's a reason why we tell you not to smoke, right? If we tell you not to smoke, it's because smoking causes lung cancer. This is the one thing that can prevent skin cancer, besides completely avoiding the sun, which is not realistic.
right.
So that's what I would say about wearing sunscreen. Just
Now,
wear it.
when is it appropriate for someone to come in for a skin check? Like, is there a certain age that they should just automatically start going?
Yeah. So it's two things. Most people should start to see us around puberty. Um, that's usually when we end up seeing people, because around puberty you start to get acne, so we end up seeing patients then. Also, if you have a family history, so I've diagnosed melanomas in young kids, spitz nevi, which is a type of mole that is very, very close to a melanoma, and it's hard to be able to tell the difference between them from a pathology perspective. So um, if you have a family history, we should see you sooner. If you don't have a family history and you don't have any moles on your body, then maybe around puberty, 12, 13 ish. Um, you had another part to that question, though, too.
Yeah, and like if someone is looking over their skin, what are some
Yeah,
things they can look for like abnormal thing?
right. I mean, you get this question like 20 times a day, right? It's the ABCDs of melanoma, which a lot of people do know. So asymmetry, border, color, diameter. Dr. Vassilides has expanded on that to include lots of other things. Um, and, you know, embryology, family history, exposure. So all of those things are kind of factored in. If you have a funny looking mole, if it doesn't look like the rest, that's something to look out for
And
across the board. I think that's the easiest way to do it, because people will have moles on the palms of their hand, on the bottoms of their feet. They're perfectly fine. But if something doesn't look like the rest, if it's gray, if it's red, if it's not healing, if it's a funny shape, if like all of them are sticking out, but this one's flat, those are usually the ones. Ugly duckling sign.
Gotcha.
Let's default to that.
Ugly duckling sign. You guys heard it here first.
Yeah. Oh no, that's it. You're gonna hear that many times. The ugly
Really?
duckling. Yep, absolutely. That's a thing.
Okay.
That's a thing.
First time I'm hearing it.
Okay. Well, you heard it first from me, but you're gonna hear it a lot.
Okay.
Yeah.
Um,
Yeah, say hi.
so based on your vast experience, can you discuss maybe some aspects of a healthy working relationship with supervising physicians? And how do you approach physicians in terms of effective communication and collaboration?
That's a loaded question.
Sorry,
Um,
I put you on the spot.
no, no, no. That's a good question. How would you? Okay, so as a PA, as anybody, always be respectful, um, and be confident and straightforward as you can. But physicians and supervising physicians and relationships, you're always going to have something different, um, and they'll kind of dictate that. You can be as open and as honest and as fun and whatever, but your relationship with your supervising physician might not be everything that you want it to necessarily be.
Gotcha.
Um, you have to have a mutual respect, because if they don't respect you, then it's going to be pretty miserable.
Yeah.
Um, and I've had that happen. Um, Unfortunately, you have these surgeons or providers or whomever that really think that they want to have a PA, but they don't exactly understand what that really means.
Yeah.
Um, I, to this day, I had a mentor like physician when I first started with academic, and that no longer is the case. Like yeah, it's just not. We don't speak anymore, and so that is unfortunate. Um, but kind of is what it is, kind of a thing. You
Right.
just hope. I mean, like any relationship in life, you just kind of have to navigate it, and it's not. Depends on the physician, depends on the personality, depends on the team, depends on the culture.
Gotcha.
If you see a bunch of PAs and nurse practitioners huddling in a corner of an office, which I have seen in a office that I was interviewing in, like,
Yeah.
run. It's not going to work. It's not pleasant.
Right. Yeah, I know one of the jobs I worked for before derm, they brought on a PA, and the surgeon thought her position was medical assistant. Like he knew she was a PA, but the things that it would ask her to do, it's like a nurse could do this, or the front desk can do this. I shouldn't be doing this stuff for you.
Right, right,
It never
right.
clicked.
No. And part of it, especially when you first have a job, is learning everything else. So, like, I will say that, but you have to have expectations with your physician. And I don't think from my experience, a lot of physicians don't do this. And I really wish that they would, is that they take on these PAs and they're like, okay, look, this is your first job. Say it's your first job. I want you to know what the front desk does. I want you to know, and you're just like kind of training them as they go, just in medicine, just in the practice, treat them like they don't know any of it, and then say, okay, you're going to hang out with them. You're going to see what they do for a little bit. You're going to hang out with them and see what they do for a little bit. That way you really understand, like, all of the aspects of what goes into a clinic. Um, but there's a lot of things with training after we get our licenses that I wish was a little bit different.
Yeah, it could be a little more streamlined. I feel it's where you end up that dictates like your core training after school.
It
So
can. And sometimes it's not the PA's fault, clearly, but
right,
you also have to be aware enough to know that, like, yeah, this isn't working or you need a different fit. And I don't know.
Oh, Katie, did I lose you?
Nope,
Okay, sorry. Screen
you're
went
good.
off. There we go. Okay.
You got them.
Oh, one last question.
Oh,
One last question. Uh,
okay.
so the process of becoming a PA or any medical professional for that regard is very daunting, humbling, long journey. What do you do to distinguish, this is personal Katie versus, my work life? Like, how do you like, where's your work life balance? What do you do for me time or what do you find joy in?
Well, that's kind of changed over the years, I suppose. Mostly so me time and work life balance and all those things. It's hanging out with my like family and friends and, you know, traveling and doing stuff that I enjoy, hanging out at the pool, having like going out to dinner, working in my garden because I'm like a little lady now and I have a garden.
I saw you
Um,
went to Italy recently. How
I
was
went
that?
to it. Yeah, it was amazing. That was amazing. Italy and Switzerland, so taking vacation.
Right.
Um, dermatology really afforded me the opportunity to be able to. I mean, we had to pay off my husband and mine student loans, so like that was. I mean, that's 7 years into our careers between both of us being professionals, and we were still paying off student loans. So. Dermatology and aesthetics clearly can be very lucrative, and I was finally able to do that. And you're able to really start saving and taking vacations and enjoying. I mean, not that you have to be able to go to Italy and Switzerland, but just being able to take the time off and relax and recharge um, is an absolute must. And really, like, work, Katie, is a little bit more serious than at home. I try to be the one that's like, go with the flow, not make all the, I mean, I have to make all the decisions because I live with boys. So, with two little boys and one larger, bigger boy, um, I still like make dinner and keep the house up and organize all the activities and do all of those things. But I really try not, I have to keep such a rigid schedule at work and like really have to stay on my game there that I just want to relax at home and not have to worry about everything. So I rely a lot on my husband. And that's a big thing too, like making sure that your partner really understands how draining medicine can be. I mean, derm is way more cush than all the other stuff that I've done. But I will tell you, talking to 40 patients a day and listening to everybody's issues, plus I mean, all this other drama that goes on in offices, it's a lot. And you're just like, at the end of the day, you're like, how did I make it through? And
Yeah, and you're reviewing charts, you're reviewing pathology,
oh, yeah,
all
we haven't even
stuff.
talked about the work stuff that you got to get done.
Right,
That's just dealing with the people.
right.
That's just dealing with people and the patients and the after work and all the stuff. So just, I don't know, find somebody that can understand that because it's a mess sometimes. I'm glad he's not a physician. If he was, ooh,
Too much.
it'd be too
Well,
much. Too much.
well,
But
thank you, Katie, for
yeah,
taking time out of your day. Um, After it's all said and done, do you think that this was the right profession for you, and would you do it all over again? Be a PA?
110. Yeah, 110%.
Awesome.
110%. I still always tell, and Blake gets really ticked at me. I'm like, I think I'm going to go to medical school. He's like, no, you're not. Can you please stop?
Yeah,
Then I'm like, I think I'm going to go get my MBA. And he's like, no, you're not.
you
Can
just paid
you
a
not? Don't do that. I'm like, yeah, but then I could do this, this, and that. He's like, no,
so you like your career,
I do. I love my job. And a lot of people can't say that.
right?
Blake tells me all the time, he's like, I don't love my job. I do it because I have flexibility. I enjoy it to a degree, but I get to love my job, which is really, really nice.
Awesome.
Yeah.
Awesome. All right. Well, thank you, Katie. I'm sorry we had to reschedule so many times,
No,
but
you're good.
we finally got it done.
You're good. No
Awesome.
worries. Is this
Uh,
a podcast or an interview cast? Like, does this go on your
yeah,
YouTube channel? What is this?
it's going on YouTube. But I'll edit it down. I'll
Oh yeah, fine.
very G rated. Yeah, I have two two other people that I've interviewed, but life's been so crazy. I've rescheduled so many people. I think I'm like, Katie's my last one. I don't even want to do any more interviews.
Oh, bless your heart.
And
No,
so sorry. So
it's so much. That's so I mean, shoot, even having to post on Instagram like twice a week and I'm like checked out. No way.
it's too
Mm,
much.
I don't know.
Awesome. Well, I'm gonna let you go, Katie, so I can
All
get back.
right. Good luck.
Thank you.
Call me if
Bye.
you need anything.
Will
Bye.
do. Bye.